The two most common serious complications are infection. Even in the best papers, about 1 in 100 risk of infection. The factors that will increase your risk of infection are obesity, diabetes, and some other risk factors such as smoking in particular. If you do have an infection, this is not a simple thing. You sometimes have to have everything taken out, a temporary spacer put in, and then everything put back in again. If this happens to you, it is a long and painful process and something you need to be very conscious of before the surgery goes ahead. The second major complication in joint replacement surgery is damage to nerves around the hip or knee, in particular sometimes the shoulder, and again this can be a catastrophic complication should it happen. Quoted risk for neurovascular injury is somewhere between 1 in 300 and 1 in 3,000 for shoulders, 1 in 300 for knees. So somewhere between that is a ballpark figure, but again, these can be catastrophic should they happen to you. If we go to hip replacement, for instance, there are other complications that are specific to that type of replacement you have. So you may have a dislocation risk with hip and shoulder replacements in particular. Both shoulder and hips might feel that the limb is longer, and often that'll settle over the ensuing months. But very occasionally you might feel that there is a permanent leg length discrepancy after that sort of surgery. The other risks, fracture, implant failure. Most of the implants we use these days we'd expect to have a prolonged lifespan, but occasionally you can have catastrophic early implant failure, which is unpredictable. The risk of deep venous thrombosis, which for hip and knee replacements is about 1 in 50, and pulmonary embolism, about 1 in 1,000 with the latest treatments that we have available to us. Again, there are some things that increase your risk, so if you have any family history of bleeding problems or blood clots, please let us know. So just things you need to be aware of. There is always a risk that surgery will make things worse. Do not believe surgeons who tell you otherwise.